Eastern Palliative Care defines palliative care as a concept of care that provides coordinated holistic nursing, medical and allied health services for people who are facing a life-limiting illness. Our care focuses on quality of life and is delivered in the environment of that person's choice, usually their home. The care provided includes physical, psychological, social, emotional and spiritual support for people, families and their friends. The scope of palliative care services also includes grief and bereavement support for the client, family and other carers during the life of the client and after the client's death. From time to time, clients with active symptoms that are causing distress may wonder about the capacity of palliative care to help them. This distress often resolves as symptoms are controlled with help from specialist palliative care clinicians. However, the distress may cause clients to wonder temporarily about the point of life. We ask all clients to please tell us if symptoms are difficult or are causing distress. Eastern Palliative Care recognises the wide divergence of views about voluntary assisted dying in the community and the many fears about death and dying. These views demand an informed response about the capacity of palliative care to assist people to live well until they die. The World Health Organization, WHO, states that palliative care neither hastens nor postpones death. At Eastern Palliative Care, our position is that the evidence-based practice of palliative care does not include voluntary assisted dying. Eastern Palliative Care believes that dying is a natural process and that declining or withdrawing overly burdensome or ineffective treatment is every person's right. We invite the opportunity to have an open discussion with the client and their family regarding their values, goals, and the nature of suffering. We recognize that the role of palliative care is to offer reasonable means to relieve discomfort and to support the person in the dying process, not to determine when death will occur. Eastern Palliative Care welcomes open and frank discussion within the community and the health professions about all aspects of death and dying, including advanced care planning and the importance of basing those discussions on accurate information about palliative care. We believe that quality palliative care services should be available to everyone in need of such services, and that adequate funding for palliative care services should be provided. The Voluntary Assisted Dying Act allows eligible people to take a substance prescribed by a doctor that will end their life at a time and place of their choosing. There are strict guidelines around accessing voluntary assisted dying, and the process involves several assessments. Under this legislation, organisations can choose the level at which they will be involved, although no health professional or organisation is allowed to initiate a discussion with a patient or client about voluntary assisted dying. At Eastern Palliative Care, we will not provide voluntary assisted dying related services. We emphasise that we will continue to be there for our clients and their families, irrespective of their decisions. We will continue to provide support to clients and their families throughout the course of their illness and into bereavement. Eastern Palliative Care remains committed to enhancing quality of life, which is respectful of the inherent value of each human life. Please give us an opportunity to help improve your quality of life so you are living well every day. Eastern Palliative Care. Living well every day.